This session will have two speakers. Actually, Dr. Garber mentioned that Dana Goldman, who was originally on the program, couldn't make it because of a family emergency, and Tom Wildsmith was kind enough to step into the breach here, literally at the last minute. So this session is really to talk about healthcare delivery and the value of medical technologies. We have two speakers who will talk relatively briefly, 15 to 20 minutes. And then Dr. Garber will join the two speakers up here, and we'll have a conversation among themselves and with you. So first, I'd like to introduce Mark Pauly, who's the Blendon Professor at the University of Pennsylvania and also a regular commuter to Washington. Professor Pauly has been a consultant to the Agency for Healthcare Research and Quality, Medicare. He's published several books, one of which is just recently published. And he's not really into the book tour thing because he actually has a copy of a book, but he left it at his desk. He was supposed to show it and wave it.
I forgot to bring the product. Terrible product placement.
And we were supposed to, part of his contract was we were going to put it right up here so you couldn't miss it. It's one of those few great books in healthcare economics. It's written in English, not economics, and it's short. Yeah, it's very short, which is good because it's full of good ideas. In any event, Mark is also the co-editor of the International Journal of Healthcare, Finance, and Economics, which I can tell you is unfortunately written in economics and not recommended light reading, which isn't a reflection on the editor at all. In any event, Professor Pauly will talk about healthcare delivery and the value of medical technologies. Mark, the stage is yours.
Thanks, Bob. You also get to see me again at lunchtime. I'm a humble person, so you would guess I didn't volunteer. I will weave in a few comments on Alan's presentation. Let me say at the outset, though, that I agree with the great majority of what he had to say. I've also dived into the bill and felt submerged, and I appreciate hearing Alan's talk because now it means some of those parts I won't have to read as well. But so I'll probably sound, as economists seem congenitally brought up to sound critical, but that doesn't mean I don't agree with the great majority of things he said. I am going to talk about three aspects of health reform, and I might as well put my heart on my sleeve and say one of them I'm actually very much in favor of. Another one, which is partly what the book called Health Reform Without Side Effects is about, I'm distressed at. And then the third one, which I'm not quite sure what I think yet, although I'm worried about it. So let me say what those three parts are. The part that I'm very much in favor of is we're finally going to do something that makes a serious dent in the uninsured population, dramatically reduces the number of uninsured people. I actually wrote my PhD thesis on that, where I advocated income-related tax credits to help people buy health insurance. So I'm still rewriting my thesis, but that some of that seems to be embodied in the legislation, so I'm happy about that. The part that I'm more concerned about, and I think there's some probably more harm than good here, although maybe it's better to do something than nothing, is essentially the conversion of individual and small group insurance into a regulated public utility, and I'll say a few words about that. The third part, though, which is actually what I'll talk about in more detail, has to do with the cost containment part, which is obviously the part that's most germane to medical technology. So that's kind of the brief outline of my remarks.